I want to ask Elizabeth if she'll speak. She's had her hand raised for a while.
Please.
Elizabeth.
Hello, namaste everybody. Very happy to listen to you all. I would like to say that the one who has the power wishes to maintain the power, but I think we should bring the power to the individual and empower people and learn to deal with their senses and make sense of what they see, hear, feel, touch and smell in the world. If our world is polluted by the beginning already, that influences, I think, the scientific approach of our datus, of our elements. So I referred to Matthias de Smet, who is a clinical psychologist, and he was saying like there is a massa, people are being misled by the crowd, and the crowd is misled by the one who has the power. So we have to bring back the power to the individual people to get back to their inner Shakti, I should say, like the creative force within ourselves, and learn how to get back and withdraw our strength within ourselves. I'm following, of course, some seminars, and there are like some very beautiful examples of like, it's very simple. I mean, nature is very, very simple. And if we follow the nature will guide us through. And I think Mother Nature is really kicking people off, or I mean, giving us the example of returning back to her wisdom. And I think that's why I love so much Ayurveda, because it is the wisdom of life. So the power should get back to Mother Nature, to the people who are holding her powers, who are treating her with respect. And that is what I want to share with you. Like Matthias, he has really a very beautiful explanation of if we lose our sense, we get fear, we get depressive, we are going to buy all these medicines, and that machine is bringing the cycles of we are buying things where we lose our strength. And I think with Ayurveda, we can really tell people how to get back in the power of nature and the power of life. So that's what I want to share with you.
For those in the audience, I just want to introduce Elizabeth. Elizabeth is coming to us from a small town outside Brussels. And Elizabeth is a Kalaripayat practitioner. She has spent a long time in Kerala learning Kalaripayat, and she's very passionate about the Indian sciences. And is also a member
and the sword. I like the sword, of course, but you know, I was more interested in the Dasavatar, like in mythology. So as I'm an artist, I'm a choreographer. I think the one who tells the story has the power. So I'm telling the stories of the Dasavatars, and I think we are reaching the 10th avatar, which is Kalki. And I think like the inner strength is what Kalki teaches me, at least in mythology, is to learn how to get in the light. And I'm very strong, I'm quite spiritual, because I think what India learned me is the spiritual, the spirit. The matter has again to be transformed by our spiritual tools. And the one who has all this information is India, where I cannot learn this in Belgium. I have to go to India to learn that. So I'm very happy to meet India and Bharat, which is my mother.
And Elizabeth is very good. She teaches young children in Belgium Kalaripayat, and she wants to do more of it. And I hope it will all happen.
I will do it next week in Amazashram in France.
Also connects with. Thank you, Elizabeth. I think.
Thank you so much. Enjoying your webinars, everybody. Thank you.
And thank you for your comments on the chat as well, Elizabeth.
You're welcome.
And it's
co-creation.
A pleasure. Can you put on your video so we can see you and say namaskar to you?
Oh, I'm not having my video on. I don't know how to do it.
Okay.
We have to promote you to, let me see how to do this. We have to promote you to, maybe Bhaswati can do it, promote you to be a panelist.
No, she can turn on if she wants to, but she hasn't done it yet. I've already allowed her to.
But I don't.
Can you turn it on?
But I don't see the screen of the video.
Okay, let me, Elizabeth, let me just see if I can get you to be.
There she is. She's back.
Okay. There we are.
Elizabeth? Did you disappear? Oh,
Oh,
there she is.
you're sitting in the dark there. We don't have enough. Oh, thank you, Elizabeth.
Namaskar, namaskar to you. Namaskar to you. Thank you for your comments.
Stefan, who, Bhaswati, I don't know.
Yes, I can.
Stefan, if you would like to, please, we promoted you to panelist, so if you could turn on your video. Oui?
While Stefan comes on, I just want to introduce Stefan Heinz. Stefan.
Hello?
Stefan? Oh, there's Stefan. Stefan is coming to us
Yes,
from.
I'm here.
Stefan is coming to us from London. Stefan was born in Essen in Germany, and from a very young age, I think at the age of 16, he decided to leave Germany to discover new ways of life and thought and living. He went to the Himalayas. He met many masters in the Himalayas. And,
18.
18, yes, and which is also a very good age to go out to the Himalayas. And he then has followed an amazing path, doing many things. And most recently, he connects with a teacher in New Delhi. His name is Raja
Chaudhary. Mm-hmm.
Raja Chaudhary. And Raja has been teaching him a little bit about the energy aspects and spiritual aspects of the Indian traditions. And Stefan is very special because for the last 15 years, he's had the chance to spend time with first-year medical students at University College London and to teach them about the Indian sciences. And he's done it again very successfully this year. And maybe Stefan will tell us a little bit about it as we go into the discussion, as he goes into his presentation. Stefan, thank you. Welcome. Thank you for being with us.
Thank you for this warm introduction, dear Madan. Yeah, I'm very happy to be here. It's such an exciting conversation, and it's a huge inspiration, I have to say. And with all the aspects that are being shown, I think we were really at the heart of the matter, also within this circle of conversation of how different viewing points of what we perceive as our reality can be the cause of bias, how we interpret supposedly objective data that is being published. And I think this is really, really interesting for me to see. So yes, what I wanted to say, it connects a little bit to what Elizabeth was saying before. So I've been on the yogic path and the complementary medicine path for the past 40 years, and India has played a big part in this. Raja Chaudhary in India has been really contributing in the last 2.5 years from a both very traditional lineage-oriented Sri Vidya and Kundalini Shakti and Trika Kaula yogic perspective. He has given me a deep introduction into the Shakti cults of traditional India and what they mean for us in the 21st century. So the teaching is very much about how can I be an embodied Shakti. Elizabeth was mentioning the Shakti force, and really in this dance of Shiva and Shakti, realize the underlying forces which are enabling us through siddhis to co-create new reality in the physical realm. And this is a very, very profound and transformational teaching that I have not found in my local yoga studio, Hatha Yoga studio here in London, of course. And so I would say to bring in the spiritual aspect is really, really important in these conversations, to not to fall into the trap of dualism, where we have arguments with one another because we have the different viewing points, but where we experience the oneness. Similar in Sankhya, as Madan, you would probably sign, the teachings, we need to be speaking whilst we are connected to the wisdom of these ancient yogic wisdoms. When we approach Pfizer, when we approach World Health Organization, I need to embody this force. And this is what I'm trying to do when I teach the young medical students at UCL. I've just been the last couple of weeks at UCL in central London again. And what's been shaping up in this conversation So I've been doing this for 18 years now. The young medical students now, they're much better informed than ever before. And so they're asking some very deep questions. And whereas in the early years of my presentations, it was like they're learning about communication skills, okay, with people in community. I think, Arti, you were mentioning this, you know, working in public health, it's like, how can you embody not the scientist in you alone with this spectrum of knowledge, but how can you speak into the reality of the patient who is sitting in front of you? So how can you listen as an empathic, compassionate doctor, okay? And of course, yeah, this is what they don't learn at UCL. This is not part of the curriculum, you know. So the medical students, I get feedback for the last 18 years, and once they have gone through 5 years of their training, I get the feedback from them, and the 2 meetings they have with me, those 2 hours, there's an hour actually with each student group, is that my presentation with them is really standing out as something, as a contribution into their training, where they really learn to listen in empathic ways into the deeper context of life experience of their patients. And I think that's really what we need to bring into medical education of conventional medicine. And then, of course, bring in also the holistic, the integrated, the functional medicine approach. That's also something that I address with them in those teachings. And I feel to link in what Elizabeth was saying, I feel the grassroots level and really meeting the individual is so important. And the reason why I raised my hand now was really to say one thing. Of course, this is a bit of a personal share. It ransacks my energy to be inundated by all this negative and catastrophe news, which I'm getting in the media. And I know where the switch off button is. I can't hear it anymore because I want to stay really happy and balanced in my energy. This is not some form of spiritual escapism. I just need to be, I want to enjoy my life. It doesn't matter what's happening outside around me, because when I'm in integrity with my energy and I'm centered in my central channel, you know, in connection with my Kundalini energy, then I can go out and offer a healing space, a direct, immediate, inspiring healing space to my patients in the clinic, to the, you know, medical doctors in UCL, to everybody who I meet out in the street. You know, it might be the supermarket lady at the checkout, or the, you know, the postman or the taxi driver, whatever. Always to be centered. This is very important at the grassroots work. So when I go into a shop now, yesterday I was out here and I spoke to a lot of people, and one thing really gelled for me, and that was like, more and more people are saying, stop to the government, stop to the media. I want to live well. I can't hear all this negative news anymore. And they were opening up to these conversations to me, people out in the street yesterday. And this created an opening for me, and that's what I want to stand for as a healer. It doesn't matter what technique I use, you know, for my complementary toolkit. It's about opening people up to an inspirational conversation where they, because of the quality of my listening, they connect to a spirit of inspiration within themselves, and they stand up because of the inspiration, and they say, no government, no Pfizer, no to this negative media news. And I think this will cause a revolution. You know, we have to convert, in inverted commas, we have to convert each person one by one. And I don't know how many people of us are on the call here, but if we all go out after this conversation we had today, and this hugely inspiring and provocative meeting to standards that we know and now question, that we go in our worlds and we communicate, we have conversation with everyone who we meet that connects them to their own self-empowered inspiration. I think the implications for this would be absolutely incredible, because this goes out like a wave, and it connects a bit to Madame, what you were saying. You know, we need to, these meetings here, our conversations, even if we have different viewing points and, you know, we get heated up in perhaps our responses because we have different viewing points and we have buts and all this, that we take from this something, we all question something in the establishment, and that unites us. And I want to really be connected to that spirit and take it out into my conversations after this meeting when I go out back into my London world. You know, and that would be my
Stefan, we are delighted we have at least inspired one person, Stefan. You know, you came into interacting with medical students at about the time when I think Arti would have started medical school in King's College.
Thomas's.
Yes, the St. Thomas's. And you've seen the transition in the young students over the almost 2 decades. Could you tell us a little bit more, Stefan, from when you started to the kind of students who are, you know, students born in this new millennium? These are young people, and the kind of, you are in a good position to compare these two.
Yeah, okay. So when I started in 2002, there would be people born in 1982, 1983, okay? And now they're 2002, 2003 when they were born. They were a little older this year. Actually, they were around 20. They were 18, you know, early on. I don't know why that is. I think what the major shift that has happened is we have the tutor, which tends to be a general practitioner of medicine, a medical doctor, or somebody with a PhD in medicine, whatever. They are the teachers of the medical group of the student group that I see. And they discuss beforehand, and Arti, you probably can confirm that from your experience, you know, to ask certain questions so that they train their communication skills. So I was asked in as a patient when I started this. This is what got me into this role, okay? But I was a professional practitioner in complementary medicine also. So when they asked me questions, it was like ticking off boxes. You know, the questions had been laid out. They had pre-discussed them, premeditated them with their tutor, and then it was a very formal kind of back and forth, you know, of question and answers. And it was quite rigid, I would say, almost. And so they could get their skill set right, you know, to speak with people in community that might become their patients later on with their medical doctors. Now what they're doing in the last 2-3 years, I think, but this year, and I think it's because of COVID and the acuteness of everything, I think the shift that happened in the last 2 weeks is like, I was sitting in front of these young people and they are not taking anything for granted. And they had prepared a few questions, but the questions very quickly fell down by the wayside. Our meetings expanded from 45 minutes to 90 minutes. You know, they took their break away because they got so enrolled in a conversation where I very openly spoke about my situation, about my clinical perspective, working, you know, with integrated therapies, what I think the future holds, and how the NHS has to change, and everything that's opening up with COVID. And they were so spot on and so reflective and self-reflective. That's very important. They brought themselves in, okay, their own personal process. And what I really liked is that that some students had real epiphanies. Wow, oh, this is what healing is. There was one woman, she was a young woman, she said, wow, this is healing. Ah, okay, so I'm not supposed to fix them. No, this is about making my patient understand something about their own healing. So we created in this conversation, we created a situation of oneness, where suddenly with this young woman, we looked at each other and we were in a space of oneness that I know from my yogic practice, of course. And I felt this medical student, she had a major breakthrough. And of course, this rippled out over the whole board. There were 16 students each time I see them. And it was so inspiring. Again, inspiration, a major word. And it was my feeling, the tutor, both times last week, different tutors, they came back to me and they said, Stefan, that was an absolutely extraordinary class. They, you know, they have an epilogue chat. I don't know what came out of this. I get a written report about the responses and reactions in a couple of weeks' time. But I felt, because of their enrollment and their engagement in what they were able to see at that stage in their life, how they perceive reality, you know, as 19-year-olds, where they build a family and build their lives, and, you know, very different from me. With 61 years of age, I have a different priority. These young people really got it. They got a message what that means for their reality. And I think that is the golden key.
Stefan, I want to see if I can bring in Carol. I can see a Carolina here. I don't know if this is Carolina Mays from Stockholm. Carolina, can you hear us? Hello? Carolina?
You're on mute, Carolina.
Oh.
Try to unmute yourself.
Carolina, can you hear us? She says she can't talk now. I see Sudhirji.
Comment on something that
Please, Arti, please.
I'm happy to hear that medical students at UCL are getting this kind of input. As far as I'm concerned, the sort of training I had was a very mechanistic, competitive, full of information absorption. And I was fortunate enough to kind of have a certain sensitivity, so that when I went from my 2 years of preclinical into my clinical years, I had the ability to relate and connect to patients, which a lot of the people I graduated with weren't capacitated with. And I know that I'm really happy to see what's happening for medical students now, which is that in the first 2 years, they're already engaging by going into GP practices, sitting and getting a sense of what it is to engage with a human being who's unwell. And it takes away from a very didactic type of an education and giving a slightly more holistic process. I was fortunate to have had a Gurukul type of education in India, where I saw the value of sitting with a teacher and imbibing the essence of that knowledge, which then translates itself into some kind of a healing paradigm, since we're clinicians. Because more often than not, what I saw, in as much as the medical course is very precise and concise in giving you an information background and giving you protocols for and permission to perform, what it never did was it never ever taught me as an individual to go in to have that sense of introspection, to evaluate a given situation. And because of that, even when I came to being a clinician, I was just a mechanical robot, which was operating on protocols, even though I knew that I don't agree with this, but nothing around me supported me to think outside of that. So I think it's one of the things that I think I hold a lot of value to, and it's the only way clinicians, medically trained, but people will have to change. We're evolving. It's not the same world anymore.
Thanks.
So yes, thank you, Stefan.
Arti, thank you, Stefan. Hold on there, because we have a few other new people who've never been on this platform before. Among them is Jas Bhikkhu. Jas, hello.
I know Jas Bhikkhu. Welcome, Jas. He knows a lot about medical training and.
Okay, Jas. Jas, are you there? Hello.
Jas, put your mic on.
And also, and your camera on if you want, also Jyoti Gavali. Jyoti, hello. And joining us from Tennessee is Dr. Sudhir Bhaga. Sudhirji, hello. Sudhirji, Sudhirji, namaskar. Welcome, delight to have you here. Thank you for joining us from, Sudhir is a MD. He studied medicine in New Delhi at Maulana Azad Medical College, and then over the decades, he's worked in America and spent time in UCLA teaching integrative medicine. I want to, Sudhirji, thank you so much for joining us. You've heard these comments being made about the transition in mindsets that we see. And also Arti's comment earlier on precognition. That was a very, very important comment that is something, it's so lovely to hear it coming from MD, MRCP. Sudhirji, what do you, and you've heard Stefan saying how there is an opportunity to change the mindset of the young doctors. They're ready for a change and they want to hear something new. I don't know how you feel about this, having trained in India many decades ago, worked in different establishments in the States. And we're also fortunate that Bhaswati ji is here. She has also been through the mill and seen some of the difficulties. All yours, Sudhirji, please.
I think kudos to Bhaswati, most important. What she's doing is opening up the discussion. And that is probably the very beginning to help the process. And I think Bhaswati is doing a wonderful job in creating this discussions to open up minds of people who are interested in opening up, number one, and number two, who are not, at least they're stimulated by that. And the conversation of the very beginning, why I got interested in this particular thing, was specifically what Bhaswati is doing is the hard talk, because it is what it is. And reality of what Arti has put up in practical solution, what she's doing and practicing, is actually the way we all should be practicing. And we say we do, the personalized, proactive, preventive. We say it, but in actual practice, it is very important because, like we talked about, is finding our medical system is disease-based system. Older systems are not disease-based systems. They're constitution, genotypical, phenotypical-based systems. And so personalization is extremely important. The issue in personalization, like Arti pointed out, was if you give a medicine and that vitiates or helps the pitta, but on the other hand, it aggravates the disease, or the other way around. It could be a medicine which is very, very helpful for diabetes, but it aggravates the person's basic constitution. Whether to give that medicine or not, the allopathic mindset would be not to give that medicine. Ayurvedic mindset is give the medicine, but give another substance, whether you give it with milk, ghee, or water, so that it will subside or reduce the side effect profile of, so that even though it will be helpful for diabetes, it won't cause too much damage to the basic constitution. That is where Ayurvedic concepts add on. But it's extremely important, I think, to make it very simple. And the problem in Ayurvedic systems is because they add multiple medicines, we as clinicians or physician of allopathic system get little perturbed about multiple medications put together, side effects and everything. That's all comes to our mind. So good Ayurveds usually give one or two medicines. They first will probably try to give a medicine which will not damage the person's constitution and still help the disease. But if they're not able to do that, then they will give that particular medicine which will help the disease and add substance like milk, ghee, or water, whatever can be added to reduce the actual constitutional damage it might be causing, even though it will be helpful. That concept is probably the most important concept to help the scientists or the allopathic people to bridge this gap. I think that is the extremely important thing. And Arti's in England is trying to do that in certain extent. But I think, like if you were talking about turmeric and you were talking about the nanoturmeric, the nanoparticles of the turmeric are going to be more effective, no doubt. But as Arti pointed out, who to give it, who not to give it. So make it very simple.
Invited you to ask a question.
So, DJ, I want to come back to this because this touches on that issue of evidence. You raised the nanoturmeric aspect and the intravenous turmeric stuff that Arti mentioned briefly. The intravenous turmeric, if you look at that paper I shared, it has a company from Bangalore involved in this whole thing. We have fortunate to have Jyoti with us. Jyoti, please tell us who you are. Thank you for staying with us. Tell us who you are and what you felt about the way we've been handling some of these, the tricky issue of evidence and the comments that are coming through.
Yes, sir. Actually, I'm very honored to be with this August gathering. Myself, I've pursued my MD Rasashastra, and right now I'm a faculty at Sumati Bhai Shah Ayurved College, Pune, in Hadapsar. And sir, this discussion is extremely interesting and absolutely needed actually. My focus is on PK/PD studies of Ayurvedic drugs actually. That has stayed my focus is on that. And when I teach my PG students and when I gather information from them during their dissertations, I see that they have made an attempt to see how those drugs are acting and how can you go to the metabolic pathways and how does a drug act. So that is my main focus, and I see to it that they publish that in good journals.
Thank you, Jyoti. Could you put in the chat box your affiliation? Sounds like a very interesting location in Pune. Also your contact details. There'll be many here who might want to make contact with you. Jas, I want to bring